Hi, I am Dr.A. Santhosh Kumar, practicing as consultant urologist, andrologist and renal transplant surgeon at Lux Hospital, Gachibowli, Hyderabad. Varicocele is a condition where there is dilatation of the veins which are located above the testis. These are called like bag of worms. So these veins, if you are representing clinically, when you see your testis or when you look at your scrotum, if it is visible on examination, then it is a high grade varicocele which can be grade 3 to grade 4. Coming to the grades, it can be either a complicated varicocele when patient has symptoms like chronic pain which is pricking in sensation, or the patient present with swelling in the scrotum, or most commonly patients with infertility present to our clinic with symptoms of varicocele. If the patient is diagnosed to have varicocele with high grade where associated infertility based on looking at the semen parameters, if his semen parameters are altered with low counts, motility or morphology, then these patients may need surgery for varicocele. At the same time, patients who are having chronic pain and who has swelling, depends on the grade. If the patient is not able to manage conservatively, these patients will be needing surgery for varicocele. Coming to the various options of surgery in the varicocele, either it can be laparoscopic like minimally invasive, or it can be microscopy. Whenever the patient is having infertility with varicocele, the most ideal and common procedure what we do is microscopic varicocelectomy. So when the patient is elderly, not fit for surgery, in these conditions we advise him to undergo for embolization of the varicocele. Varicocele is a condition where there is abnormal dilatation of the veins, that is called pampiniform plexus, which supply from the testis. So these, when the pampiniform plexus gets dilated, there is a chances that they may accumulate the blood and they release inflammatory toxins. So most of the patients with varicocele, they present with pain, or they can present with infertility, or can they present with chronic pain or decrease in the testicular size. So usually they coming to medical therapy, we will ask them to give some medical supportive medicines which can decrease the inflammation like painkillers or any anti-inflammatory medications, and we ask him to get adequate scrotal support. And coming to surgical therapy, the ideal treatment for varicocele is surgery if patient has definitely problems, if he has infertility issues, or if he has chronic pain not responding to conservative or medical therapy, or very decrease in the testosterone from the testis or decrease in the testicular size. So these patients ideally need surgery. So there are various surgeries which we do in varicocelectomy. Either it can be open surgery, or it can be microscopic varicocelectomy, or it can be minimal invasive laparoscopic varicocelectomy. Depends on the conditions who present to us. If they are presenting with infertility, the ideal procedure will be microscopic varicocelectomy. But if the patient has completed his family and he has only complaints of pain, then there are chances that we can advise him for laparoscopic minimal invasive varicocelectomy also. So depends on the condition. Usually we advise the patient whatever the treatment is best for him. So whenever you are diagnosed with varicocele, we have various approach of treatment. Either it can be surgical or it can be non-surgical, which is like embolization, which has come recently. So surgical depends on your treatment for varicocele. Usually the condition of varicocele which is affecting. If you are suffering from infertility, the ideal procedure, it will be microscopic varicocelectomy. If you are middle-aged person who has completed your family, and if you have only symptoms of swelling or pain, we can go for minimally invasive like the laparoscopic varicocelectomy. And the patient is not fit for surgery, elderly, suffering for the symptoms of varicocele for long term, he is the patient where we can suggest for varicocele embolization. So whenever you have varicocele, you have symptoms of pain, as I said. It can be a dragging pain in your testis, or sometimes you can present with swelling in the testis. So there is no particular diet which can avoid for varicocele, but you can decrease your symptoms following few tips, like where you avoid constipation by consuming high fiber diets, and by consuming antioxidant foods you can decrease the inflammation, which can lead to decreased pain in your testis or scrotum because of the varicocele.